Hi everyone, welcome to today's webinar. I'm Angela Knudsen from AAA Northern California, and I'm excited to moderate today's webinar, which is a recap from our presentation at this year's KIDZ in Motion conference. I am on our community impact team, and I oversee a program that has 140 technicians across 7 states, and together they complete thousands of inspections every year. We're also a supporter of the National Digital Car Seat Check Form and are very excited about today's webinar and what the presenters will share with you. I want to introduce our presenters as they present. So first, let me introduce Jennifer Bogue. Jennifer is the National Digital Car Seat Check Form Field Training Coordinator for the National Safety Council, and she has 20 years of traffic safety experience. She received her CPS Technician Instructor Certification in 2001 and has dedicated the last 16 years in her role as the Program Coordinator for the Child Passenger Safety Resource Center. Jennifer has served on numerous state and national boards and advocacy councils. Her passion lies in school bus transportation, Head Start parent education, child care and foster care training, and state and national curriculum development and improvement. Additionally, she works closely with Indian reservations in a 5-state area, providing outreach, training, and assistance with instructor development and program management. Off to you, Jennifer.
Thank you, Angela. Good afternoon, everyone. This is Jennifer Bogue, and I'm responsible for coordinating the National Digital Car Seat Check Form field trainings for the National Safety Council. This really is an exciting time for child passenger safety technicians and the field of child passenger safety, and we are equally as excited to share information about the use of the National Digital Car Seat Check Form resource. The National Digital Car Seat Check Form is being offered as a free resource to currently certified technicians and instructors, and it provides them with an opportunity to input data directly into the digital form and then use the seat check data to monitor trends, track seat distribution, and record issues encountered in the field. Until now, there's been no other national digital tracking system that we could use to provide technicians with the ability to collect, track, and monitor their seat checks electronically. Currently, the data that's being collected on paper forms can be difficult to sort through and capture specific data sets that provide technicians and organizations with vital information about the work that's being done in the field. We all know that it can be time-consuming to pull specific data sets and information that is necessary for program evaluation. While we recognize that there are others across the country that have developed their own digital tracking system, we've repeatedly heard from the field that there were 3 primary barriers for implementing and maintaining a digital system. The first one was the cost of developing and implementing and maintaining the software, and also the data storage, which can be expensive for organizations to hire out firms to collect and store necessary data. And finally, the access to online and offline systems that could be challenging for technicians. We have several partnerships with the National Digital Car Seat Check Form, and the National Digital Car Seat Check Form is managed by the National Safety Council with support from the National Highway Traffic Safety Administration. Tennessee Tech University iCube is responsible for designing and implementing and developing the digital platform and regularly monitors the digital system and implements updates to the resources as needed. AAA Northern California, Nevada, and Utah has been a huge supporter of the National Digital Car Seat Check Form and continues to support the program by supporting training opportunities across the country. The National Child Passenger Safety Board has assembled a committee of subject matter experts to review feedback from the field and will provide the National Safety Council and Tennessee Tech University with a list of updates on an annual basis. The feedback received from technicians in the field is valuable to the growth and development of this resource. We encourage all technicians to provide feedback so that we can continue to provide you with a resource that's effective, easy to use, and meets the needs of all technicians. Our current data indicates that all 50 states have registered users with the National Digital Car Seat Check Form. Currently, we have more than 1,600 registered users from across the United States, and technicians have entered almost 13,000 seat checks. There are many states that have begun statewide rollouts and many others that are in the process of moving forward and implementing the use of the National Digital Car Seat Check Form statewide. As we move into a digital age globally, the field of child passenger safety is ready for the advancements of technology, which is changing the way that we collect and retrieve data. Our goal is to support all technicians in their efforts to eliminate child injuries and deaths due to motor vehicle crashes. As you will hear from our next three speakers, we are well on our way to making that happen. I have a couple of states that I'll be highlighting that have done an exceptional job with the use of the digital check form within their state. The first state that I'll be highlighting is the state of Vermont. Currently, the state of Vermont has 193 certified technicians that are using the digital check form, and they've collected over 1,000 seat checks to date. The state coordinator reported several benefits to using the National Digital Car Seat Check Form. They recorded that there was instant access to data collected from across the state, and CPS technicians and agencies have access to their own data, and this helps to guide the technicians through their seat checks by being able to follow the step-by-step process using the digital platform. Currently, data collection provides them with the ability to monitor the total number of seat checks statewide, and those numbers can be broken down by county and fitting station. The data can be sorted by the month, quarter, or year, and will provide the state with the ability to track state program distribution seats. They continue to calculate the accurate number of misused car seats and track the most common misuses to help build their educational strategies to support their data. The data collected by region is used to build more fitting stations and determine where future technician trainings should be held based on the number of seat checks being performed in those areas. In the state of Indiana, they currently have 210 technicians that are registered with the digital check form and are currently using it, and they have recorded over 7,000 seat checks to date. The state coordinator uses the information to gather the number of seat checks that are being performed and to confirm that fitting stations are in compliance if they're receiving state and federal funds. They also gain an overall picture of how the state is doing, which encourages communication with the permanent fitting stations. The state of Indiana uses the data to collect information about the seat checks that are being performed across the state, and they create maps like this one that they can document where those fitting stations are located and what fitting stations are performing the most seat checks. The information collected is run in a comparison with the crashes around the state involving children, which is then used to strategically create fitting stations based on those statistics. As we move further into our digital age globally, the National Digital Car Seat Check Form is advancing the field of child passenger safety and the way that we collect and analyze data. We all work towards the common goal of eliminating motor vehicle injuries and deaths to our smallest passengers, and the National Digital Car Seat Check Form is providing technicians with a tool designed to improve reporting and data collection. As you'll hear from our next speakers, the data collected will have significant impact on the child passenger safety field as well as car seat and vehicle designs. If you'd like more information about the use of the National Digital Car Seat Check Form, please visit the National Child Passenger Safety Board website at cpsboard.org, where there are links to our tutorial videos, how-to guides, and our frequently asked questions. Thank you.
Great, thank you, Jennifer. I want to now introduce Julie Brewer. Julie is just one member of a fantastic team at Tennessee Tech University's iCube. iCube has been working to shape the culture on our roadways for almost 15 years, dedicated to keeping drivers and passengers safe by using innovative technology, creative solutions, and an experienced, dedicated team of problem solvers. Julie has been managing the statewide seatbelt and booster seat safety program for Tennessee since 2007. The Ollie Otter program's educational presentations involve a vast network of injury prevention advocates to reach nearly 100,000 children per year in Tennessee. Welcome, Julie.
So hello, everybody. Thank you all for your interest in the National Digital Car Seat Check Form. I'm going to use the next few minutes to share some updates and answers to frequently asked questions and tips on using the check form at its highest potential. So, big question number one, where do I find the app? The answer to that question, yes, the app really is free and it is available in iOS and Android and just released in October. The app is now available in the Amazon App Store. You will need a data connection to download and install the app from the App Store of your choice for whichever device you have. If you have more than one type of device, feel free to download it on all of the devices. So the app was designed through a collaborative process of technicians working with technicians to make the app user-friendly. The team at TTU is comprised of car seat techs, injury prevention advocates, and traffic safety nerds, and we like stuff to be easy. So when asked what kind of device should be bought, we relate it to the question, what kind of car seat is the best? Just like car seats, there are a few different factors to consider. Whatever is the easiest, whatever you can be accurate with, and whatever fits your budget. So some Samsung, HTC, Asus, iPad, the functionality is going to be the same through all of those devices. You can even use the device to enter car seat checks through the website or the app, and if you prefer, use the paper form in the field, then enter the info through the website or app to submit your seat check to the data, your seat check data to the national system. A few tips though, remember that this is going to be used in the field, something lightweight with anti-glare and long battery life in a protective case would be some additional items to consider for your device. Another big question we get asked is how much data will it use? The app stores your files as text, so it's not a big file. It's not going to be like downloading music, pictures, or movies. You have to log in the first time with a data connection to set up the app and load things like agency lists and technician info. But since the data is stored inside the app, it does not store in your phone memory, and once you connect to Wi-Fi or data, you will be able to upload your checks and remove them from your device's app storage. So the big question number 3, what about personally identifiable information? The National Digital Car Seat Check Form does not collect PII, but for reassurance, the app utilizes a secure server through Acquia. The server has daily backups that are saved for 3 days, and Acquia also has a contingency plan for hourly backups in place for disaster situations. There will always be a paper PDF to collect data in the field and enter on a PC or a tablet later on. So, question number 4 that we get, can I practice with the app? Yes. Select training as the state that your event is taking place in, and this will keep any practice forms separate from real seat check data. So, and finally, a few tips about setting up your National Digital Car Seat Check Form account. The first step is to take a picture of your CPS Tech wallet card. Step 2, create an account at carseatcheckform.org and upload your CPS card to the profile. We need your current card information to verify your technician status. We'll confirm your tech number and then activate your account. Your account will be deactivated on expiration. When you renew your certification, take another picture of your new card and upload it to your profile in advance of your expiration date, and your account will be extended to the renewal dates. If you have any questions or would like to provide feedback, we are ready to help. Send an email to info@carseatcheckform.org. We're ready and waiting.
Great. Thank you so much, Julie. I'm a fan of the app. I've been using it here in our headquarters where I typically don't have data in our big parking structure, so it's so great. Moving on, I want to introduce Adele Polson. Adele Polson is a senior study director with Westat Center for Transportation Technology and Safety Research. For over 20 years, Adele has researched traffic safety, and she specializes in large-scale data collection efforts focused on occupant protection. Adele manages the National Occupant Protection Youth Survey on behalf of NHTSA, and for over 10 years, Adele has been researching child occupant protection issues and has also been a certified CPS technician, regularly volunteering as a senior checker with Safe Kids Montgomery County in Maryland. Most recently, Adele has begun work on helping analyze the National Digital Check Form data. Very exciting. Welcome, Adele.
Thank you very much. And thank you so much for including me in this discussion today. We're sincerely excited to start this important work and to harness Westat's tools, talents, and knowledge to help the CPS community. Okay. I'd like to quickly introduce you all to Westat, who we are, what we do, and how we will be helping the National Digital Car Seat Check Form program. I'm going to review our goals, process, and research questions that we'll answer. I'll also review our ideas and our suggestions for the future. So first, who is Westat? Westat is an employee-owned research firm known for the quality of our professional staff, covering a broad range of research expertise, including statistical design, survey research, and program evaluation. As you can see, our major study areas encompass a wide range of topics, including transportation, behavioral health, and public health. Our research, technical, and administrative staff totals more than 1,900, with an additional 1,100 field staff engaged in data collection throughout the U.S. Since 1963, Westat has grown steadily by serving federal and local government agencies, private businesses, and other clients. Westat was founded by statisticians and continues to put an emphasis on providing data, analysis, and insight that informs our clients' efforts to improve lives. That's why our slogan is Improving Lives Through Research. Our headquarters is located in Rockville, Maryland, in the Washington, D.C. metro area. We also maintain 11 other offices in the U.S. and 3 internationally. An emphasis on statistics sets Westat apart from other firms. I've worked closely with statisticians for most of my career at Westat, but it took me a very long time to fully appreciate the skills and talents that they provide. First of all, not all statisticians are the same, so I like to use the analogy of the medical field to help explain. So let's just start with someone like me. I've taken a few stats classes and I can conduct some basic analysis, so I consider myself the equivalent of a person certified in first aid or CPR. But at Westat, we have many PhD statisticians, and that would be the equivalent of general practitioners or family doctors. And additionally, we have statisticians, the equivalent of cardiac specialists and neurosurgeons, who are very highly specialized. In the statistical world, that equates to people with specific degrees and training to conduct sampling and weighting, survey design, data management and analysis, data science, and program evaluation. At Westat Center for Transportation Technology and Safety Research, we have another important department within the company that has a long history of providing research support to agencies of the Department of Transportation, as well as state, local governments, and private industry. Our staff is composed of over 30 professionals and includes engineers, human factors professionals, survey research specialists, GIS specialists, programmers, and psychologists. Within the center, there are 4 of us that are certified technicians. We were all trained by and worked with Emily Crown. As transportation researchers, we understood the risks to children, but Emily gave us the tools to go out into the community and help reduce those risks. We volunteer regularly with Safe Kids Montgomery County, Maryland. Additionally, the 4 of us work on a number of child passenger safety studies, and we will all contribute to this work with the digital check form. Work in the center covers a wide range of topics, including automated and connected vehicles, travel behavior, and road user behavior. As I noted earlier, we work with a number of federal clients. I've highlighted some of our most relevant studies here. For the past several cycles, Westat has conducted the National Household Travel Survey for the Federal Highway Administration. It's a multimodal big data survey, and it's allowed us to build and refine our survey data collection and data visualization tools. Since 1999, we've conducted the National Occupant Protection Use Study, or NOPUS. Much like the NDCF, we transitioned NOPUS from paper forms to digital data collection. We started that transition in 2002 and evolved our data collection app, training materials, data processing, and analysis over the years. We've also designed and conducted the National Survey of the Use of Booster Seats, or NSUBS, since its inception in 2005. Some examples of our CPS-related projects are a nationally representative web survey for NHTSA on caregivers' awareness of child passenger safety resources. I presented on this at Lifesavers this year and hope to show more information about this at the next Lifesavers. We also conducted an experiment that looked at both user and non-user issues in installing car seats in various vehicles. So in the middle photo, one of our technicians is prepping the car seats and dolls for the study. For NHTSA's National Child Restraint Use Special Study, or NCRUS, Westat developed the site sample. And finally, for the Centers of Disease Control, we conducted a study to update the height recommendation for proper seatbelt fit among children. When I attended my first KIDZ in Motion conference 8 years ago, I was new to the CPS world, but had been in transportation safety research for over a decade. So as I sat in those sessions, I was thinking like a researcher. I was also thinking how much I admired everyone's car seat knowledge, passion, and ingenuity in finding ways to save children's lives. I was struck by how hard everyone worked to hold on to their funding and their programs. At the time, I was helping Emily Crown compile basic statistics on the Montgomery County program for her quarterly meetings with the fire chief. She meticulously tracked every call, every donation, every seat checked, every hour worked, and every misuse case, all to convince the chief to continue to support the program. So what struck me most was that all the advocates needed the ability to conduct more complex analysis that would allow them to paint a complete picture of the success and the need for their programs. So while I volunteer when I can to help families, most of you are doing this work each day. But at each day at Westat, we conduct research, and we build, deploy, and maintain systems just like the National Digital Check Form. We collect, clean, and analyze data from systems like the NDCF. And this form represents an unprecedented opportunity to develop a nationwide database of information related to child passenger safety. Using sophisticated analysis, these data can be leveraged to improve the efficacy of car seat programs, help guide CRS and vehicle design, provide valuable insights into the overall misuse of CRSs, and support the implementation of effective safety legislation. The work done this far to develop and standardize an electronic form that is freely available to CPSTs around the US, is simply groundbreaking. Using the data set you're compiling, along with our research experience, understanding of CPS issues, and specially trained statisticians, we plan to fully leverage the data to provide new insights into child passenger safety. To accomplish this, we're going to need to undertake 3 tasks. First, we'll clean and prepare the data for analysis. We'll then analyze the data. And finally, we'll prepare a tool for data visualization and provide access to the results. As with any data set, before any analysis occurs, we'll take several steps to clean the data. These steps will create a data file that is ready for analysis in a statistical software package. We'll execute these data prep steps within statistical programs to allow for easy and automatic reprocessing of the data. Specifically, we'll check for and clean erroneous or duplicate records. We'll rename and recode variables so that they are more suitable for statistical programs and analysis. New variables will also be derived. The large number of variables collected provides a rich data set for analysis, but it can also be very daunting for users. Therefore, we'll derive summary variables, including a set of variables that flag whether there is any misuse, both overall and for common categories. We'll also complete the data set by imputing for missing data. And finally, we'll document all of this into a comprehensive codebook. Once the data are clean, we'll undertake analysis. The analysis will answer research questions that cover 4 main topic areas: program effectiveness, car seat design, vehicle design, and educational messaging. In the next slides, I'm going to go over these questions that we are going to be answering using the NDCF data. So some of our research questions are: what percentage of caregivers are your programs reaching? Who are you reaching? Which population groups are you missing? Are you missing low-income caregivers or older caregivers? What types of CRSs are checked? Are there groups of children you're missing? Is your program making a difference? Are misuse rates decreasing? Are more children arriving at car seat checks in CRSs? Are more children arriving at car seat checks in the correct CRS for their height and weight? Based on the observed installation errors, are there CRS features that should be modified? Which types of CRSs are easiest to use or result in the fewest errors upon arrival? Which CRSs have features that are more difficult to use? Does the vehicle seating position impact the number and type of installation errors? Are there vehicle types, meaning sedans, minivans, SUVs, or pickups, that possess features that make it easier or more challenging to install CRSs? Which vehicle types have the most overall errors? Which vehicle types have the features that are more difficult to use? For example, are there more lower anchor or top tether anchor errors with a particular type of vehicle? And then ultimately, how can you better target your message? What errors are made most often? What do caregivers need to be aware of? Can this data be used to influence legislation? Do state laws affect car seat checks? Does the state law impact the likelihood that children will arrive in the correct CRS for their height and weight? To answer all of these research questions, Westat will augment the National Digital Car Seat Check Form dataset with data from other sources. Census data will be linked to the NDCF dataset via zip code and will allow us to weight the data to match the population characteristics. State occupant protection use law data will be used to determine the impact of laws on seat checks and CRS misuse rates, and the child passenger safety technician list will be used to identify the proportion of technicians using the NDCF. To be able to provide timely updates to the data and allow advocates to easily access the results and all of their data, Westat will develop a data visualization toolkit. It will be linked to the existing NDCF website. Westat looks forward to working closely with Tennessee Tech to effectively integrate the toolkit into the existing site. Once in place, this toolkit will make it easy to generate data summaries and analysis. It will automatically handle variable code sets and labels, as well as generate print-ready tables, charts, and maps. All of the user privileges and data access will be inherited from the NDCF website. We are so excited to start this relationship with all of you and hope to have long-term involvement with the program. There are really almost endless possibilities to the different types of analysis that could be conducted. In future years, Westat will work closely with all of the stakeholders to consider, discuss, prioritize, and plan new analysis. Due to the current budget, the initial analysis does not fully leverage the wealth of information that could be derived from the dataset, but this first year's work will serve as a baseline on which more sophisticated analysis can be built. To enable a deeper understanding of the NDCF data, additional datasets could be added. So one possible dataset is the Fatality Analysis Reporting System, or FARS data, and it could be linked to the data by state and zip code to allow comparisons of misuse and fatalities. We could also investigate integrating historical paper form data. Additionally, Westat proposes conducting weighted analysis. Unweighted data provide estimates that are representative of those car seat users and seats that are participating in seat check events. And these estimates are very useful in describing the characteristics of the population that agencies serve, providing estimates of misuse rates and so on. And this is exactly the type of data analysis we'll be providing in the first year. However, weighted data using population-based analyses will allow scaling of this limited sample up to the entire population of CRS users. It would also allow us to generate more nationally representative estimates. As we amass more data, these estimates will be more comprehensive and more powerful. So, in future years, the analysis will be more layered and offered more detailed insights. For the first year, we will look at everything at this top level, highlighted in the row at the top of the slide. We'll produce national level estimates which report on misuse among types of CRSs and vehicles over the previous year. We'll answer all the research questions and provide a new and comprehensive picture of the current program coverage and effectiveness, CRS features which reduce or increase misuse, vehicle features which reduce or increase misuse, and solid data to use as the basis for adjusting educational messages to address these identified issues. In subsequent years, we could drill down to the regional, state, or local agency level. We could also look at all of these topics across years to identify trends of improvements or areas of regression. We could report on misuse as it relates to specific CRS makes, models, and features. We could do the same with vehicle makes, models, and features. The level of detail of the data provided in the NDCF offers new opportunities to more fully evaluate car seats and vehicles, to more precisely identify issues so that solutions can be effectively developed. The digitization of the car seat check form is a major achievement and a critical component in the collection and analysis of local and national data. Having conducted an initial review of the current software application and speaking to technicians who use it, Westat believes that the usability of the app could be further enhanced to reduce the burden on CPSTs and increase the quality of the data. First, by employing additional range checks of individual responses, we can further eliminate incorrect data. So, for example, currently the form allows the user to enter a date of manufacture that's in the future. Further refinement of the data could also be realized through additional consistency checks or validity checks among related items. For example, if a CRS is reported as not present in the vehicle upon arrival, it should be impossible for a technician to enter a CRS make and model. To determine other suggestions, Westat proposes conducting additional usability testing of the app. Westat's Instrument Design, Evaluation, and Analysis, or IDEA team, has extensive experience in designing and testing data collection tools. We also have cognitive interviewers who specialize in evaluating how users interact with websites and software programs with the goal of reducing user burden and error. We propose meeting with CPSTs who are using the app and solicit their feedback. After all of the testing, Westat would compile all the suggestions into an easily usable format, and we would work closely with Tennessee Tech to test all the modifications. Another important ongoing task is annual and monthly maintenance. In the first year, we will only update the data once, but we realized local state agencies need timely access to their program data in order to monitor progress, identify current issues, and target outreach efforts. Therefore, in the future, Westat would like to conduct monthly updates to clean all new data, analyze all new data, and update the data visualization toolkit. Using an API, Westat would create a user dashboard that allows access to analysis results as they're updated. After the first year and in each subsequent year, maintenance and updates to the various programs will also be required. Westat proposes annually reviewing and updating all the input data sources, such as the CPS state laws. Based on changes to the NDCF, updates to the data prep programs and analysis program and data visualization tool would also be required annually. Westat would also provide feedback on the NDCF based on issues identified during data analysis. As you all know, data analyses are most useful when the information is readily available to the stakeholders. Given the wide variety of stakeholders, the presentation of the analysis results must be customized to target audience who need to use it. Westat can develop customized reports that work across multiple channels, such as web products, print materials, social media, and earned media. Westat can employ our in-house graphic designers, multimedia production staff, web designers, and translation professionals to develop creative materials and messaging using the results of the NDCF analysis. Thank you again for having me here today. Westat is honored to be part of this groundbreaking program. We believe this data and analysis can lead to significant improvements in child passenger safety. Thank you.
Great. Thank you so much, Adele. That was really great and exciting times ahead for sure. I want to now move on to our last presenter, Sarah Haverstick. Sarah serves as a safety advocate for Good Baby International, which includes the Evenflow, Cybex, GB, and Urbini car seat brands. Sarah is currently celebrating her 12th year in child passenger safety. She is a certified child passenger safety technician instructor and an instructor in the safe transportation of children with special healthcare needs. She has held positions on numerous local, state, and national boards related to injury prevention and is a former chair of the National Child Passenger Safety Board. Sarah received her bachelor's in political science from Rutgers University and has some exciting things to share with us today. Off to you, Sarah.
Thanks, Angela. Happy to be here today and chat from our perspective as a car seat manufacturer with how we intend to utilize the National Digital Check Form. So first, we'll use it like you will use it out in the field. So we currently, internal to our company, have over 45 car seat technicians, but we're in 4 different corporate office locations, plus a number of car seat technicians that work for the team that actually work remote from locations all across the country. So as you can imagine, it makes it a little bit challenging to be the one person responsible for all of those technicians and the work that they're doing. We often host focus groups and photo shoots in our office areas. And inevitably, a family is going to ask questions. Hey, can you look at my car seat? Oh, I think I'm not doing this right. So this way, our technicians will no longer need to try to figure out where the paperwork is, know what they need to do. They can just go right out to the vehicle, and with access on their mobile device, will be able to complete a check form just like they would at any other time. So I'm really excited that it's going to give our team a little bit more flexibility in the work that we're doing, and especially when we're directly interacting with consumers. But the most exciting part for us is the data, and it's so fun to get to speak after Adele because I think there's a lot of excitement happening with this data analysis and evaluation. For us, we've never had to really track what we do internally. We don't report to a grant funder. It's very different for me, having come from a children's hospital back in the day where I had to do a lot of grant reporting. That was a big piece of what I did. And now we just do car seat checks because we want to give back to the community, and we just do them. And there's nobody that I have to tell how many car seats we've checked or what we've done. But I think at this point, and especially with 4 different office locations, it'll be a really unique opportunity for us to look at what's going on. And I think I'm excited about maybe some internal competition between some of our different office locations to see who is checking the most seats and what's going on in each of our individual corporate communities. So excited about that ability to actually see at a better level what we are doing and how we're contributing to our communities. But the big piece that we get to do that's a little bit different than how other technicians will use this data is we get to actually access manufacturer level data. So when I log into my dashboard, not only can I see the seats that I've checked or the seats that any of my team members have checked as the point person for the Good Baby brand, but I can also generate a manufacturer report. And when I generate that report, I just get a huge spreadsheet, so a very large Excel file with lots of raw data. This is just a very small snapshot of it to give you an idea of what that looks like, but this is everything that you're putting in on that form. So we know what type of restraint it was, what manufacturer it was, and because as you heard, Good Baby is our big overall umbrella company, we actually have multiple brands. So you can see we have Evenflow brand noted here. We also have a Cybex seat noted in this list. So we'll be able to separate out by brand, by model number. All of that data that you would be inputting into your form is what ultimately ends up in this spreadsheet. So it means we have the opportunity to manipulate that and look and see what kind of trends do we see with our own product and across our brands. So I did a quick little snapshot of how car seats arrived just for the Evenflow brand, and I did this a few months ago. So this was early on in that national rollout of this form. When I reviewed the data, I found that only 6% of the car seats that showed up at the event, Evenflow car seats, were expired when they arrived. Thought that was a pretty good number. 6% was lower than I probably would have expected to see, so that made me smile. And less than 1% of those car seats were recalled when they showed up at the event. And you know that we really want to get those expired, those recalled seats out of circulation. So that was, both of those numbers made me very happy to see when I saw this data. 42% of the car seats were secured according to our instructions. That's not a happy number, definitely not the number that we want to see, but probably not surprising to any of you listening that do a lot of work out in the field. We often see misuse. We often see things that weren't done exactly as manufacturers noted them. So that's an area that we know that we want to improve. 41% of the car seats that arrived were correctly using a tether when a tether should have been used. So 41%, again, not a good number, but a number that's probably not terribly surprising to anybody listening. And then 11% of the car seats were not facing the correct direction. And that one I thought, again, was surprising, and surprising in a really good way. For Evenflow, we require children to remain rear-facing and to not utilize any of our forward-facing seats until they are at least 2 years old. So for only 11% of those car seats that came in to not be facing the correct direction per our instructions, I thought was a really big win and was an exciting piece to see. But it's not just, is this right or wrong? We get a lot more data and a lot more detail into what's happening with this form, which is really beneficial for us on the car seat manufacturer side. So it's not just whether or not the tether was used or the lower anchors were used, were they right or wrong, but why were they wrong? What was the misuse? And that's where you get to click those boxes when you're going through that form and tell us in more detail exactly what was happening. So I looked at lower anchors specifically for this, and we found that 49% of the lower anchor car seat installations were not correct. So out of those, I've listed on screen the top 3 lower anchor misuses. And I'll tell you, you heard Angela said, I've been a technician for 12 years now. I've done a lot of car seat checks. I very much expected to see number 3, the incorrect use of vehicle anchors, as overwhelmingly the number 1. Often when I check seats, that's what I see. Latch borrowing in the center seat when the vehicle or doesn't allow those lower anchors to be shared between the outboard positions. That's what I expected to see. And I was actually really surprised to see that the number 1, and it was really overwhelmingly number 1 misuse for our even flow seats, was lower anchors used with the seatbelt at the same time. That's an area that we write about in our instructions. In multiple places in our instruction manuals, we have indications that you should not use both of those together at the same time. So this is something that I've already taken back to our technical publication team to share with them, that it's a way that potentially we could look at how we are providing that instruction and what other information could we be sharing with the consumer to help eliminate that type or limit a little bit that type of misuse that we see. Number 2, you can see too loose. That definitely was expected. And incorrect use of vehicle lower anchors is number 3. The other thing that we're really interested in is what are our consumers driving in terms of vehicles? And for us, we can't test every one of our car seats. So if we're going through a new product development and we are creating maybe a new convertible car seat, we can't take that convertible and put it in every single solitary make and model vehicle. It's just not feasible. There's way too many combinations out there. But we really want to make sure that we are testing seats in a representative sample of vehicles. But what is representative? So we've been looking a lot at what is our consumer driving, and that's something that we can see when we look through this data as well. So we can have a better feel for what types of vehicles are our consumers driving, and in this case, what I'm showing here is the vehicle by model year. So what age is the vehicle that our consumers are driving? In 2019, the average age of light vehicles in operation in the U.S. was 11.8 years, which is roughly that 2007 model year. So you can see where I've highlighted that was the most popular model year that we did see in the vehicles that came in through these checklist forms. But you also see a lot of newer vehicles in this representation. And then I looked at some key numbers. 1996, that's when we had lockability requirements for car seat installation. You can see there were really very few vehicles that were checked pre-1996 in this cohort. And then you can look at, tethers and lower anchors and look at that 2001 to 2003 area. And there really weren't that many vehicles that were checked in comparison to all of the others that didn't have access to lower anchors or tethers in the vehicle. So it gives us a better idea about what technology that consumer might have available to them in a vehicle. But we don't just get our manufacturer report. We actually get another report called the aggregate report. And this allows us to look at trends across all of the seats coming in. We do not get to see the manufacturer of the seat or the specific model of the seat anymore. So that information is gone. All we see is what type of seat it is. Was it a rear-facing convertible, a forward-facing with harness, a booster seat, etc. But it gives us that opportunity to kind of compare. If we're seeing an issue with one of our rear-facing convertibles, is it something that's just specific to one model for us? Or is it across all of our convertibles? Or is it across all convertibles when you look at this aggregate across all of the manufacturers? So it'll give us a better idea if it's a problem that we need to solve within one of our own products, or if it's something that as a community, as a group of technicians, as other manufacturers together, is it a different type of issue that we should be tackling? That aggregate report looks a lot like the manufacturer level report that we have, so I didn't show you that spreadsheet because it's basically the same. But I did take a look at what the lower anchor misuse was in the aggregate report, since we looked at that for even flow. There was less than a 5% difference between the even flow misuse and the aggregate, as you can see here. 44% of the lower anchor car seat installations across all the brands were not correct, so pretty similar. And they were indeed the same 3 top misuses. Seat installation too loose, used with a seatbelt as number 2, and then the incorrect use of vehicle anchors as number 3. Again, I expected that number 3 to be up a little bit higher. And in this case, across all of the brands, it wasn't the lower anchor and seatbelt together that was the number 1, but just that loose installation being the overwhelming number 1 here. So it gives us something that we can take back to the team, we can discuss as a group, and we can see where can we make some updates and where can we help improve that user experience. So at the end of the day, I wanted to share this with you because I hope it'll make you excited about what you can contribute to. And really all of that information that Adele shared, you have the opportunity not just to have better access to your own data and to have maybe an easier way to complete your car seat checks, but you could potentially be contributing by all of the work that you're doing collectively out in the field. You're contributing to hopefully improvements in the way that we are designing new product and the way that we're sharing information about how to use product. And that's a really exciting thing. So my big takeaways for you are really just take your time. You know, as with anything else, it's hard when it's 95 degrees and 100% humidity and there's a line of cars out the door, but just like every car seat check, you know, you want to give that family that you're working with all of your time and attention, and take your time working your way through the form. Practice it with it a few times before you move to that digital platform, just so you're comfortable and you're familiar with it, because your accuracy with the data that you're collecting is really important. That's the way that we're going to be able to really make an impact when we have this huge field of really accurate data. And then be specific. You know, if there's more than one misuse with those lower anchors, note all of the misuse. You have the opportunity to check all of those boxes. So make sure you're really specific in the things that you're seeing, and in the open areas, because there's a few areas where there's open text boxes, share the information that you have. The more specific you are, the more helpful it is for us on the manufacturing side, really understanding a picture of what was happening at that event. So that's all I have to share. I'm really excited about this opportunity and hope that this is helpful for you.
Sarah, wow, that was wonderful. Thank you so much. And thank you again to all of our presenters. We hope that their presentations inspired you. And if you aren't already doing so, we hope you consider using the National Digital Car Seat Check Form so we can all be a part of really contributing to this change. This slide shows all of the resources available to help you get started. So thank you everyone for your time today, and thank you for your efforts to keep those kiddos safe on the road.